This is a video summary of our study about adequacy of imaging follow-up for Crohn's disease patients using mixed CT enterography and MR enterography. The title of this study is Mixed Use of MR enterography and CT enterography adequate for routine periodic follow-up for bowel inflammation in patients with Crohn's disease. Both CT enterography and MR enterography are appropriate for the diagnosis of disease and treatment monitoring. Monitoring of disease by imaging examination is regularly conducted for every other year to evaluate treatment response, and both studies are similarly accurate for the detection of active inflammation. MR enterography is preferred for young patients in respect of radiation hazard and wide spectrum of information, and CT enterography is more accessible and affordable compared with the MR enterography. Accuracies of both studies are similar, but the accuracy was about the diagnosis of disease, detecting presence or absence of bowel inflammation, and the accuracy of the study as a follow-up examination, assessing change of disease activity, is not well known. Both examinations are appropriate for the monitoring of disease, but the indication is not well established as a follow-up examination, and it is unclear whether CTE and MRE are interchangeable or not. So, the purpose of our study is to compare a mixed use of CTE and MRE, and MRE alone for the indication regarding reliability between multiple leaders and accuracy assessing treatment response. This is material and method. We recruited 2 patient groups following these inclusion criteria. We enrolled adult patients diagnosed with Crohn's disease who conducted MR enterography in the second half of 2016 and the first half of 2017, and assigned this MR enterography as index MRE. Patients were excluded if there was no comparable previous or next examination, and the patient who underwent bowel surgery during the follow-up period was also excluded. Among the 258 patients, 284 patients had prior CTE or MRE, and 209 patients had next examinations. Index MRE followed by the CT group revealed the least enrolled patients of 48, and we randomly chose the other 48 patients from another mixed modality group, which was the group of CTE followed by index MRE, making 96 pairs of enterography using mixed modalities. And the same 96 patients were randomly extracted from the MRE alone follow-up group. Overall, 192 pairs of enterography were selected, and these were reorganized in reading sessions of batches, including 10 enterography pairs, composed of 5 mixed modality and 5 MRE alone pairs. We organized the reading sessions to reflect everyday practice and to avoid cramming too many cases in a single reading session, or any potential interference interpreting consecutively many cases solely from any one group. 3 independent readers were recruited from 3 different institutions, and the leaders evaluated changes of bowel inflammation for entire small bowel and for the terminal ileum in separate. Terminal ileum was defined as the most distal 10 cm of ileal segment, and new terminal ileum was defined as 10 cm of ileal segment from ileocecal anastomosis where patient underwent bowel resection. Assessment in bowel inflammation change was classified in the 3 categorical order of increase, unchanged, and decreases disease based on these image findings. Disease evaluation for MRE alone follow-up group were based on image findings, including the length of the involved segment, bowel thickness, mirror tissue signal intensity, presence of diffusion restriction, and mucosal ulceration. This image is an example of decreased disease activity, showing decreased mirror thickness, tissue signal, and diffusion restriction. An evaluation of a mixed CTE and MRE follow-up group was based on image findings both available in CTE and MRE, such as length of inflamed bowel segment, mirror thickness, and mucosal ulceration. The case is an example of decreased disease activity using mixed imaging modality. Bowel thickness and length of involved bowel segment are mildly decreased. The primary outcome of the study was a comparison of inter-reader agreement in mixed modality and MRE follow-up groups. The intra-class correlation coefficient was calculated and compared by z-test. The secondary outcome of the study was a comparison of accuracy in both groups. Endoscopic results within 3 months were used as a reference standard. Results with a complete agreement with endoscopic evaluation were considered as accurate assessment. Accuracies of both groups were compared by generalized estimating equation. And let me show you the results of our study. Inter-reader agreement of MRE alone follow-up group is significantly higher than that of mixed modality group, showing ICC value of 0.683 compared to the 0.473 from mixed modality group. The trend was similar in terminal limb assessment, and there was no significant difference according to the order of modality. Sorry for the busy slide, but the most important message of this slide is in the upper left table. Two opposite interpretations have occurred only in the mixed CTE and MRE group, whereas there was no such case in MRE alone follow-up group. And what about the accuracy? The accuracy was calculated in 57 pairs of mixed modality group and 55 pairs from MRE alone follow-up group. Accuracies of each leader were higher in MRE alone follow-up group, ranging from 71 to 75% compared to the range of 58 to 65 in the mixed modality group. But the p-value calculated from the GEE model was 0.077, which indicates an insignificant difference between the two groups. In conclusion, inter-leader agreement was significantly higher in the MRE alone follow-up group, and accuracy was also higher in the MRE alone follow-up group, but the difference was not statistically significant. It would be due to relatively small subject size, and further study with more subjects may be needed. Therefore, consistent use of MR enterography for disease monitoring may assure more accurate and reliable assessment. Better soft tissue discrimination of MRI and various available information from MR sequences like DWI and T2-weighted image may contribute to the good inter-observer agreement in MRE alone follow-up group. Thank you for your attention.